ready, who is Dr. Piyush Kapur. And if we could actually go ahead, we have seen all the.
So,
Yeah,
yes, sir, sure.
yes,
So,
thank you.
next we have with us Dr. Piyush Kapur, who's Chairman Healing Touch Super Speciality Eye Center. He's here with us operating for a left eye cataract
फाइलों काट
surgery
देंगे
of a
क्या
71
फाइलों
year
काट रहे हैं
male.
फाइलों काट लेना
The cataract is NS1 cortical PSC, and now we have the lens that he's going to implant is 19.5 diopters. So, looking forward to his surgery. Over to the OTs, please.
A very good morning to all. Am I audible?
Yes,
Yeah,
yes,
good
very
morning, Dr.
clearly.
Piyush. Dr. Bhalla here.
Good
Hi, sir.
morning.
How are you? It is always a pleasure you
Yeah,
being on the chair.
same
So, this is a patient who is having a astigmatism of 1 diopter, and with the beautiful overlay, I am making the markings for my targeted implant to be done at about 5 degree. So, it's a grade 2 cataract. I'll be implanting a Rainer EMV lens. I generally prefer to make my side port incisions through which, for the patient comfort, I prefer to inject a phenocaine, which gives a much intraoperative comfort. Visco. To talk about the present cataract surgery, I think all of you sitting at the panel would agree with me that the time of monofocal lenses is almost fading away. With the beautiful technology of enhanced monofocals coming in, I think the monofocal plus and the monofocal enhanced lenses are taking away the major share, as without a disadvantage of any kind of dysphotopsia, these lenses actually give a good depth of perception. Overlay hata dijiye ab.
Yeah, absolutely. I think we would 100% agree with the same sentiments, Dr. Kapur.
exactly as we are shifting.
In my practice for the past now 3 years, I have almost decreased the monofocals to a mere negligible, and mostly the practice share is with the monofocal plus or the EMV lenses. Of course, as we see, there are too many crowding in the market with different technology. I think most of the lenses do very well, and with a bit of difference in their optic design, most of them perform quite good, with a slight difference in terms of the depth of vision as we get in these lenses. I have an experience of almost having implanted more than about 9,000 plus monofocal plus lenses. Visco.
That's a huge, huge experience,
That's
Dr.
it.
Kapur.
Yeah. I think as we have more dependence on the intermediate vision in this digital technology where we look at our laptops and mobile phones, I think this monofocal, rightly said by Dr. Piyush, are gradually making way for enhanced depth of focus lenses. And with the advantages of decreased glare, halos, and symptoms of dysphotopsia, and even contrast sensitivity is much better compared to the trifocals. Enhanced monofocals or extended depth of focus lens are here to stay.
Yes, of course, like people do have a perception. I keep talking to surgeons, they generally have such kind of inhibitions at times that maybe that the monofocal plus may also have a comparative low vision in terms of the quality of distance vision. But in my experience, I would say most of them are absolutely fine. Of course, it is not a myth when the wave is there in the mind that these lenses do have a bit of difference, maybe in some eyes where the patient may not be crisp 6 by 6 at times, but mostly these patients are as good as what they do with the monofocal lenses. Feco 2 kar dijiye.
And do you practice micro monovision with these EDOF lenses?
Yes, I almost do it for all my patients. And the best part with the EMV, why I love this lens is that this lens is actually designed in for a micro monovision plan. Like if you do a normal micro monovision in any of these lenses, the patient generally has a jump of depth. Like in one eye, the patient may be not having that much of a depth perception, and immediately when you change to about say 0.75 or a 0.5 myopia, there is a sudden jump in the distance vision. But here, because of the spherical aberration platform which these optics have, Pico 3 please. So these patients generally with the micro monovision थोड़ा सा flow बढ़ा दो, aspiration बढ़ा दीजिए. और बढ़ा दीजिए. और वैक्यूम भी बढ़ा दीजिए थोड़ा. I am generally used to a little higher parameters which I am getting in this setting, but it's comfortable. Like in the live surgery, I would say Dr. Gaurav has rightly set the settings at a little lower platform so that the surgery goes comparatively safer.
Yes, absolutely.
So when I was saying about the micro monovision, that EMV lens, because of the spherical aberration, they have a better, they have a more depth of perception. Typically, as any of the eyes with abrasions, like some corneal issues and all, like keratoconus and all, they generally have a more depth of perception. The same concept plays when we induce spherical aberration to a very minimal extent in these lenses. So the blend is such that when we actually give a micro monovision for the other eye, the comparison between the two eyes blends so beautifully that the patient hardly comes to know. Visco de dijiye.
So when you look at the micro monovision, what is the dioptric difference that you keep between the two eyes?
Mostly with EMV, I generally plan about a 0.5, and that generally gives a patient comfortable N6 vision.
Okay.
Mostly these patients are up to about N8 or N10 when we aim a emetropia with a slight myopic shift. These comfortably reach up to even about an N6 partial.
Right. And I think more and more now intermediate vision is becoming more important for our age group because there are a lot of people who are on the computers, on tablets. So to have the best vision, best quality of vision and independence from glasses from intermediate is what many of them are looking at.
I would actually acknowledge that whenever we used to have discussions in the conferences, I always used to say that I am definitely looking forward for these lenses where the compromise will be less. Actually, the near vision, when we say, is not that much of a need.
Correct.
When we say the 33 centimeter and all,
Right.
it is actually the intermediate vision and the distance vision which is actually required to the full perfection for a good livelihood.
Absolutely.
Most of the patients, when I generally talk about a monofocal plus or an enhanced monovision lenses, they generally say कि डॉक्टर पढ़ने के लिए तो थोड़ा सा एक नंबर का चश्मा लगा ही लेंगे. So and I explain them कि बहुत छोटा पढ़ना होगा तभी लगाना होगा, and most of these patients एक कैप पैक कर दीजिए please.
Yeah, I think very nice cortical cleanup, and we have seen a beautiful demonstration of both the nuclear management and also the cortex in this patient. And you can also appreciate, I think everybody can see that there is a dense arcus, and one has to be careful in the periphery when you are taking the side ports because this kind of eyes are slightly more prone for Descemet's detachment.
I think arcus is quite common in the hilly areas. The next thing about the EMV lenses is their beautiful injecting system. The injector is about a 1.6 millimeter tip which goes comfortably through the 2.2 incision, and it is called a lock and roll system, very musically termed lock and roll, and I remember the song Roll Baby Roll with this. So it goes so beautifully, you
Absolutely.
don't have to bother about any engagement with the haptics or anything. It is like you just load the visco, comfortably lock the injector, and you just need to push it without any kind of a problem.
Yeah, and I think the unfolding was also quite quick and beautiful in its position. What is the
The
astigmatism of
best
this
part is
patient?
very comfortable folding, unfolding, and it is never with a jerk. It goes very perfectly.
Absolutely.
The C loop design which this Rainer has, which it actually gives a very good centration. As you can see, the C loops basically work as shock absorbers.
Right.
And even if there is a slight kind of a prone for a decentration from a push from any side, it actually centers so beautifully that the decentration with these lenses is recorded as low as about 0.08 millimeter
Yes, sir.
in most of them.
Yeah.
So the premium lenses, when we are talking about the toric implants, when we talk about any of the trifocals and
Yeah,
all,
absolutely.
the way to go is the design which these lenses have.
Superb.
Thank you, thank you.
Thank you so much, Dr. Kapur. It was a beautiful demonstration.